Trump was trying to destroy Obamacare. He wanted to erase everything that America's first black president ever did. And there's no doubt in my mind that this was part of his white supremacist agenda. But it also, was very profitable for the insurance companies. He said, hey, because there were these little bridge plans that could not last more than 90 days, as I recall, where if you lost job A and you were going to job B and it took a month or so for job B's health insurance to kick in, you could buy a short-term plan that would cover you. Well, Trump expanded those to 3 years. So this guy, his name is Corey Dowd. In the spring of 2019, he found himself unemployed. He had left the Peace Corps and he got a new job, but he needed an insurance policy. He bought one of these Trump Care policies, and he thought, hey, gee, it's got $1 million deductible. Monthly premiums are only $100 each. And best of all, the plan promised to cover up to $1 million in claims and a second claim up to $750,000. He said, this is going to be great. He's 31 years old. He ended up with a $33,600 bill. So we got that. We've got these high deductible plans, which are killing Americans. And then, we've got this creeping into the privatization of Medicare. So I wanted to get a professional take on this, somebody who really knows what they're doing. A former health insurance industry executive, Wendell Potter, is now the president for the Center for Health and Democracy. Business for Medicare for All.org is the website. The Twitter handle, Wendell Potter, of course. And Wendell, you're still running Tarbell, too, right?
I sure am. I chair the board for Tarbell. So thanks for mentioning that too, Tom.
Sure. That's TARBELL.org?
That's correct. Yeah, thank you.
Great. So Wendell, tell me about, what's the deal with these kind of three categories? I know you wrote an op-ed about, let's start with these high deductible health plans. Your title, Trump's high deductible health plans are killing Americans. Tell us about that.
Well, they continue to kill Americans, and ever since the Affordable Care Act was passed, even before that, but certainly since the Affordable Care Act was passed, deductibles have been creeping up and up and up. And even if you get your coverage through an Obamacare exchange, you could be on the hook if you're an individual for deductibles of $8,500, $8,550, and for a family, the maximum deductible is $17,100. Most people don't
Which could wipe out most American families.
Oh, absolutely. Just about half of Americans don't have $400 in the bank, much less $17,000. So these are just absurd. And just last year, some of those who were involved in crafting the Affordable Care Act acknowledged that that was a big mistake to allow insurance companies to continue to jack up these deductibles, and they increase every year. That was part of the law. And as a consequence, Americans are underinsured. They're not able to pick up their prescriptions in many cases. They can't go to the doctor. If they have to have treatment, go to the emergency room or whatever, they get hit with big bills they can't pay. So a lot of these folks with insurance are winding up in bankruptcy or turning to GoFundMe. It's just an outrageous situation.
Yeah, it really is. It's obscene that this would even happen in the United States. Wendell, by the way, what's the title of your most recent book?
Nation on the Take, How Big Money Corrupts Our Democracy and What We Can Do About It.
That's right. I wanted to be sure to plug that, too, because it's an absolutely brilliant book, Nation on the Take by Wendell Potter. Wendell is our guest right now. Business for FOR, Business for Medicare for All.org. That's the principal website, right, Wendell? Do I have that right?
That's one. I've got another organization that I lead called Center for Health and Democracy.org. And the word democracy is in there. It's related to my last book because advocates for healthcare reform need to understand that the reason why we have such trouble getting the healthcare system we need is because the entrenched special interests, like the industry I used to work for, the health insurance business, spend so much money to influence elections and public policy that they can pretty much call the shots in Washington or the state
And that's
Capitol.
not democracy. Yeah, that's not democracy.
You know that.
So, Wendell Potter, tell me about these Medicare Advantage plans. I'm seeing more and more benefits being advertised by Joe Namath on TV. And yet I keep reading articles about people who get, is essentially screwed when they get really seriously sick or need long-term care, and they have Medicare Advantage plans. What's the story there? We've got about 3.5 minutes to the break.
It's a big scam. It's a big scam. And in my old job in the industry, I used to be a champion for these health plans. I even encouraged my parents to enroll in them. And I found out, and my mother did, is just what the limitations are. You're exactly right. As you get older, a lot of people try to disenroll. In other words, they try to get out of these plans, get back into traditional Medicare. It's not so easy, and I'll address that in a minute. But one of the reasons is because there are such limited providers available to you for long-term care, for skilled nursing care, that you find that the care that you need from the providers you want to see just isn't available to you unless you pay an enormous amount of money out of your own pocket. And these plans are operated exactly like commercial, like regular plans. They have small networks in many cases, or inadequate networks. They require prior authorization, which is another thing that people need to be aware of. That gives the health plan, the insurance company, the ability to say, no, we're not going to cover that. So it's a big scam. The insurance industry, insurance companies have learned how to make money off of this program, though. It's become their big cash cow, and they spend enormous sums of money hiring people like Joe Namath and others to shill for these plans.
So if we were to successfully go to Medicare for All, and Medicare Advantage, which is now about a third of all Americans who have signed up for Medicare, have signed up for one of these Medicare Advantage programs, these scam programs that have been so aggressively promoted by Joe Namath and others on TV. If we were to go to Medicare for All, well, is this going to be the snake in the woodpile or whatever? Is this going to be the thing that ultimately bites us, that attacks us?
It could be, and Congress will have to address that because with improved Medicare for All, which is what we advocate for, there would be no need, no market for these Medicare Advantage plans. The current program, the traditional Medicare program, needs to have more benefits. It does not cover dental or hearing or long-term care. Right. It doesn't cover vision. So that needs to be addressed. And the out-of-pocket obligations are too high, too. So there needs to be a cap on that. You can be certain that the insurance industry will fight that. They make a lot of money on these Medicare supplement plans as well. Almost everyone, not everyone, but those who can afford to buy a supplement policy do with traditional Medicare because it helps you cover your out-of-pocket cost.
Right, that 20%, that skin in the game that the Republicans were insisting on back in the 60s when LBJ put Medicare together.
Exactly. They still talk about skin in the game.
Yeah, and that skin in the game phrase, I mean, that was, I remember those times. I mean, that phrase was on the news every single night. It was like,
oh, yeah.
Oh, if you don't have skin in the game, you're just going to exploit the system. You're just going to live in your doctor's office. That's what you're going to do.
Exactly,
But really that was put into place to provide an opening for the for-profit health insurance companies to make money on Medicare, right?
Oh, it's true. And when the Medicare program was created back in the 60s, it was modeled sort of like after private plans. But healthcare costs back then were not nearly as high as they are now. The programs, both private and public, have not kept up with the rising costs and healthcare costs. Medicare much better than private plans, for sure.
Yeah. Remarkable stuff. Wendell Potter, businessformedicareforall.org, Twitter handle @WendellPotter, tarbell.org, and what's the other organization, Wendell?
Center for Health and Democracy.org. So check us out.
Centerforhealthanddemocracy.org. And check out Wendell's book, Nation on the Take.